Last month, I wrote to Health and Human Services Secretary Becerra regarding protecting critical infrastructure within the healthcare sector. In that letter, I highlighted the need for a strong relationship between public and private partners to ensure the safety of U.S. critical infrastructure systems. I also inquired about legacy information technology systems. Cyber attacks on our healthcare system not only have severe impact on our economy, but put lives at risk. So my first question is, what's UnitedHealth Group's relationship with HHS and other government agencies as it relates to cybersecurity of the healthcare industry? How have HHS and Cybersecurity and Information Security Agency worked with your company in the aftermath of the cybersecurity failure?
Senator Grassley, thank you for the question. We've had a close engagement, I would say daily engagement with particularly CMS within HHS. CMS have been extremely engaged and supportive through this, particularly in terms of how we've worked to support providers and to prioritize recovery of the system. And the FBI has been our prime partner in terms of law enforcement and response to the attack itself.
Does the UnitedHealth Group use legacy IT systems that need to be updated? If so, what's been done to update?
So Change Healthcare is a good example of a company that came into our organization with older technologies, a 40-year-old company with many different technology generations within it. As we always do with new companies like that, we strive to upgrade them to the standards of UnitedHealth Group, which I believe are consistently higher than the companies that we brought into the organization.
I think you touched on it, but let me ask specifically, has UnitedHealth Group taken every available action to immediately remove memory safety risk in its IT and software?
Sir, could you just repeat that, please? I couldn't hear the second part of the question.
He asked you to repeat it.
What?
Repeat it, your question.
Oh, refused to answer it.
No, he just said he couldn't understand.
Oh.
Here.
Well,
So he just asked you to repeat the question.
has UnitedHealth Group taken every available action to immediately remove memory safety risks in its IT and software?
I'm not sure I completely understand the question around memory safety risk. Okay. I can assure you that since the attack...
Why don't you do this? Answer that question in writing.
Absolutely. Yeah. Happy to do so.
My understanding is that Change Healthcare touches 1 in 3 medical records in the United States. I'd like to better understand how Change Healthcare stores and manages patient data. How does Change Healthcare manage and store patient data? Where is the data stored? Is it stored by third parties? And at what point through processing, coding, and storing is patient data ever sent overseas?
So Change Healthcare stores data both on premises in data centers and also to a limited extent in the cloud. As we've rebuilt the technology environment, we have moved much more into the cloud, which we believe creates a much more secure future environment.
According to the FBI, there were 249 ransomware attacks against the healthcare industry in 2023. Has UnitedHealthcare Group experienced another cyber attack since February 21?
I'd have to come back to you on that. We are under attack consistently. I'd like to make sure I'm accurate in how I respond to that question, and I'll be happy to come back to you with that.
In writing, okay. Do you feel like your company is prepared for another cyber attack? And this will be my last question.
Senator, thank you for that question. We are doing everything we can to be as prepared as possible, but we recognize the pressure of the attacks that come in. I believe that we are taking every sensible precaution, and we've brought in multiple third-party expert organizations to supplement our own teams. Where I hope we can also look for is ways in which we can start to reduce the attack pressure on the systems that we're all trying to manage.